Welcome back, everyone. I'm Nora, the Executive Manager of WSA. We just finished with the session Learning and Education, one of the most important topics because it's so necessary for all our other categories, actually. But one other category that even became more important during the pandemic is health and well-being. I couldn't think of a better person than Tanja Wehsely, the CEO of Volkshilfe Wien, to moderate this session. She is very much involved in this topic and supports during different health crises in Vienna and Austria. So over to you, Tanja, and thanks for moderating.
Well, thank you so much, Nora, and hi everybody all around in the different MS Teams channels and AirMeet channels and all around the world, if it's in the morning or midday or evening. I'm Tanja, as Nora said, Tanja Wehsely from Vienna, Austria, and I'm the CEO of a big foundation that is involved in elderly care and refugee care, which is really important right now. As you can imagine, Vienna, Austria is a very close country to Ukraine, where we can see really hard times of the Ukrainian people in that war they are fighting now. Refugees keep coming. So why am I saying this? Because this is really concerning me at the moment a lot. We have crisis meetings every day to see how the millions of refugees that flee Ukraine can be sheltered in the European Union. Poland, Moldavia, they are really close, but so is Austria, and we're doing our best. And so I think this category, health and well-being, is also very, very important, not just during the past years of the pandemic, where we really had to, put a lot of thought in digital healthcare and trying to get to people that cannot go outside. Now it is really important to use all this in the refugees crisis. So I'm really interested in your pitches. I'm involved in WSA for a pretty long time. I really appreciate it and find it great. I was a city councillor when we first were able to host the WSA in Vienna City Hall. So I've been with the jury and fond of WSA ever since. And so we have a short video right now from the WHO, so Department of Data and Analytics. I'm looking over here. It's the nice Steve McFeely who is sending us a message through video.
In 2015, the Sustainable Development Goals outlined a common vision for a better future. Despite the setbacks caused by COVID-19, they remain our roadmap, and we must not lose focus on ensuring everyone everywhere enjoys better health and well-being. This is the vision of the World Health Organization, to promote the highest physical, mental and social well-being, and not merely the absence of disease. As a global steward for health data, we work every day with scientists, with civil society, with academia, with policymakers and young people such as yourselves to address data gaps, to focus on results and deliver impact. The theme of this gathering, Hack the Gaps, is very fitting. One of the biggest lessons from COVID-19 is that we still have many gaps to fill, particularly around the lack of high-quality data, digital health solutions and telemedicine in many parts of the world. Both to our winners today and all of those who applied, your creativity and dedication demonstrate that a better world is possible, that a digital divide is not inevitable, and that when you combine local content with smart technology, then true change is achievable. To our 5 winners in the health and well-being category, from Belgium, from Brazil, from Egypt, Estonia and Iceland, I congratulate you. I also congratulate Lend an Arm, Young Innovators category from Nigeria. You are the hope for a better future, a future that we all need so badly right now, and I look forward to seeing where your work takes you next. The World Health Organization stands ready to support you in whatever way we can, and I thank you for the opportunity for allowing me to take part in this session.
Okay, I'm back after Steve McFeely. I'm not quite sure if you heard the countdown like I did, but you know, we're supposed to be relaxed and everything. So I hope the winners in the categories are too, and you're getting prepared. So I'm just briefly going to tell you how this is going to work, so you can you know, get ready and kind of lose being nervous. There's nothing to be nervous about. Say hi again to the fellow jurors. Good that you're here. Please get ready. Also welcoming right now Tomasz Pessoa e Costa. He's the founder of Dioscope. Will you want to wave your hand, Tomasz, so we can see you? He's going to join us later on in the panel discussion. So, guys, all the pictures, you have 3 minutes, and I'm going to be really strict about this. So we can have another 3 to 4 minutes Q&As of the jury. So dear jury, maybe you want to already think about some questions that you want to ask our winners that are going to start pitching in a bit, so we can, you know, move on and keep this flowing, and then finish with the good panel discussion. The voting criteria, jury, is the 3 criteria. So you want to please watch the pitch. How is it presented? Is it clear? Do you see the strategy? Do you know what the product is about? That is number 2. Is the product clear? Do you understand what it's there for? Was it, you know, presented clearly to you? And 3, what do you see as the impact? What is the local impact? What is maybe the level of potential that it could have for a even global impact and for scaling up? So this is how it's going to work. And I'm asking our first winner, are you ready to introduce yourself? And it is FibriCheck from Belgium. Go.
Hello, everyone. So I'm sharing the pitch, if that's okay. Do you see the screen?
Yes, I can see it.
All right, perfect. So normally it's, yeah, that one I cannot solve. I hope that's okay. All right, so just imagine, what if you could install an app on commercial devices like smartphones that turn these devices into medical tools to detect and follow up on cardiac arrhythmia, thereby preventing strokes from happening? That is exactly what FibriCheck is doing. Hello everyone, my name is Bieke and I'm one of the co-founders of FibriCheck. When we started our company back in 2014, we had a very clear goal. We wanted to contribute to a longer and healthier life for people by the timely detection of cardiac arrhythmia using device-agnostic solutions. Our initial focus was on atrial fibrillation, or AFib, a silent killer affecting millions of lives. 1 in 3 is developing AFib in their lifetime. And the challenge is that AFib is hard to detect, as it often goes symptomless, or it can have an intermittent nature, so it can come and go. And unfortunately, still today, 20% of all strokes are caused by undetected and untreated AFib, though 75% of these can be prevented by the timely detection. So what we need are scalable detection tools, but that's often the challenge of traditional medical technologies. And that's the reason why we developed FibriCheck, a device-agnostic software solution that can be used everywhere, anytime. FibriCheck is certified as a full medical device, backed by more than 50 clinical studies. We are available on more than 17,000 types of smartphones in different languages. From a user perspective, FibriCheck is super simple. A user just needs to download an app, and cardiac arrhythmia monitoring becomes as simple as putting a finger on the camera of your own smartphone each time for 60 seconds. A user gets immediate feedback, but can also request for clinical support if needed. The user feedback is overwhelmingly positive, not only in the support of finding serious cardiac arrhythmia, but also in offering peace of mind when people are worried about their heart health, and thereby avoiding unnecessary use of our healthcare systems. FibriCheck is today contributing to a longer and healthier life. We have been used by close to 1 million people across the world. Over 100,000 people were supported in finding cardiac arrhythmia. 30,000 were detected with AFib, and for them, we prevented a potential stroke from happening. Also, doctors start to prescribe FibriCheck to their patients, and it is our mission to collaborate with local healthcare system and stakeholders to make FibriCheck as much as possible free for everyone. 3 minutes is short, so happy to answer any questions. Thank you.
Thank you so much. That was wonderful, really. I mean, I'm even interested if anybody has questions. Yes, I can already see Gabriele Tatzberger from Vienna Business Agency. You have questions, and thank you so much for this really wonderful pitch. It was to the point, and I guess we understood everything. Gabi, you want to go?
Yeah, hello, do you hear me?
Yeah.
Yeah, thank you for the great pitch. It's really a very interesting and useful product. Could you explain us a little bit your business model so that we have an first knowledge from your side about that?
Thank you.
Yes, of course. So FibriCheck is used in different settings. We focus on letting doctors prescribe FibriCheck to patients, so they can also telemonitor the patients at distance. In this setting, the hospital or the healthcare system is paying, and the patients can use it for free. In countries where we are not that far yet, people can also directly use the FibriCheck application based on downloading and paying.
Okay, thank you. Gabi, I think that was okay for you. Next question, please. Chica, you want to go?
Yes, I would. Danke. Bjeke, I would like to know what was the biggest achievement you had with FibriCheck so far?
I think from a challenging perspective, it is clearly regulatory approvals, including the FDA approval processes. From a personal perspective, it are the daily feedback of our users that are each time an achievement when they let us know that we support them in their heart health, in supporting to find the dangerous cardiac arrhythmias. That's actually where the drives and motivations comes from.
Mm-hmm.
That's great. Thank you.
Thank you. Tomasz, you have a question?
Yes, I do. First of all, congratulations for your app. It's amazing. I just want to know if you also measure other cardiac risk factors, such as blood pressure, glucose, because, for example, if you are monitoring heart failure cohort of patients, it's not only the arrhythmias that are important, but also the other risk factors. So I imagine a big solution with all the risk factors being monitored and not just focused on the ECG. But I don't know how do you do that?
No, excellent question, and indeed, you always need to look at different angles. FibriCheck is really focused on cardiac arrhythmia, different cardiac arrhythmia, but the solution can be integrated into systems whereby you can also integrate, for example, blood pressure and stuff like that to assure that physicians can have an overall view of all comorbidities and different health parameters of their patients.
Thank you so much. So I can see no more hand raised. Everything is clear, and I don't think we need to, prolong this. If everything is clear, the most important questions were asked. Do I see one more question? No. Okay, well then, thank you so much to FibriCheck. Wonderful pitch, really great. Guys, 3 minutes, that's it. So let's see how we can do this with all the next winners. Thank you so much. And I will move on to digital oncology service, Anariá from Brazil. I can see you that you are already here. You might want to get ready and put your slides
you can
on.
Stop sharing your screen.
Yes, please. Sorry.
Okay, thank you. It's a pleasure to be here. Nice meeting everyone. I'm Sabine, one of the founders of SS Brazil, and I'm here to talk about the Anariá project. Let me just put it full screen. Is everything working there?
Yeah, you put it full screen and no stress. So
yeah,
if we are ready, then we'll start.
3 minutes is the huge challenge. So
yeah.
I'm a swimmer, but
are we ready for the pitch in the 3 minutes? Because I don't see my clock.
Okay, let me just put mine also because I'm a swimmer, so time is always an issue, and I will put it. So
okay.
I'm conscious.
So please, ready to start. Go.
Okay. Perfect. So I'm here to talk about what if we could make cervical cancer diagnosis faster and show how we are doing that in Brazil. This is a huge challenge worldwide. It's the fourth most common cancer among women, with over 250,000 deaths per year. And 85% of these deaths occur in developing countries like Brazil. Here alone, we have over 45 million women that are in the age range that they have to do a series of exams to do screening and eventually treatment of the disease. Early diagnosis here is the game changer. It increases 10 times the chance of cure and reduces 70 times the costs of the treatment. I'll give you an example. Luana is one of our patients. She's one of these women, lives in a city that has no access to a specialist doctor. This is very common in Brazil. And every time she has to go through an appointment, she has to travel over 500 kilometers. I won't get into details, but from the screening to the diagnosis, women have to go through 9 steps. This is a long journey. It starts with a screening test, and it's a highly inefficient process. It takes over a year, usually, from the first step through the diagnosis. I will focus in one exam, that is the colposcopy, that is key for us and what we are doing in this project. So colposcopy is an image test that we see the cells of the cervix and analyze if there are some changes in them that could be a sign of cancer. So what we are doing is using telemedicine. So here you see a picture of a doctor that's on the other side of the screen, orientating the local physician on how to do the exam and analyzing the picture through telehealth. So this is very helpful. What we are doing is reducing the process to 4 steps and taking the diagnosis to 60 days alone. As I said, this makes a huge difference between life and death sometimes. This could potentially be a global solution because we can connect doctors from anywhere in the world to patients using the telemedicine. It also saves money, saves resources, and potentially saves hundreds of lives. Also, we are using AI as a solution to scale and bring this to the next level, analyzing these images. Here are some of the partners that are with us, some of the awards that we've won. We have a big team involved, but I'll show you our head team, our leaders, and I'm really proud to be here. Hope you enjoyed the solution, and we strongly believe that this can make a difference worldwide. Thank you.
Thank you so much. Thank you so much. Really, for me, yeah, very interesting, really high local impact as I can see it. And jury, I see Thomas already raised his hand for a question. Please go.
I don't hear him. I don't know.
Yeah, you have to, please, you're mute. Yeah.
Sorry. First of all, congratulations again. Huge solution. The only thing I don't know how do you do it, but you do it, is to connect the agenda of both the specialists and the local doctors. Because when we tried to do something similar here in Portugal, it's very, very difficult to to have the same slots, or to reserve the slots in the specialist agenda, and to be able to use that slots with the local teams. So how can you do that at scale, and how can you operate in these difficult schedules?
Yes.
That's a great question. I have two answers for that. The first is we have 9 years of experience in this operation, so we have a lot of connection between the local health team and the specialists, so we can facilitate that. And the other is we're starting to do this in it doesn't have to be at the same time. So we take pictures of the exam, then we upload it in our medical record, and the specialist on his own agenda can then analyze the picture. So it doesn't have to be at the same time. So this is it's essential, so we can scale and including optimize the time of the specialist, so he doesn't have to go through the whole exam. So
yes,
that's what we're doing.
Congratulations again.
Thank you. May I just add a question before I take Gabriele? So what does optimizing time mean? What is optimizing time in time?
It's like the whole exam can take up to 20 minutes, but if you analyze only 1 or 2 or 3 pictures, then you can do in this 20 minutes hundreds of exams. So this has a huge scale-up solution when we do it that way.
Thank you. Gabi?
Thank you for this impressive initiative. It's really good to see what you're doing. My question would be if you need any regulatory medical approval, and if yes, how do you plan to do that, or in which phase you are?
That's a good question. So in Brazil, telemedicine is allowed since the pandemic, and it was before if you have a health specialist in one side and a health specialist also on the other side. So this won't be a regulatory issue for us because we don't believe we'll walk two steps back. So I think we'll be okay on that. I don't know around the globe, but here in Brazil, that's our case.
It's a really important question, I guess. And since we're both from Austria, Gabriele and I, that would be a really important question that you would have to solve for strongly regulated, countries as far as medicine goes and as far as doctors go. So I have another question, Damien.
Thank you very much. Hello, Sabine, and thank you very much for your very clear pitch. I have a question on the use of AI. You mentioned that you were looking into using AI. Can you elaborate a little bit more as to how you're looking into using it? Thank you very much.
Yeah, thank you. So since it is essentially an image test, so we're partnering up with big universities in Brazil, with professionals that have this expertise, for example, with skin cancer. That's a really common use of AI in skin cancer. So it's using this same idea, the concept behind the intelligence is the same. What we're doing is creating protocols to standardize the same equipment, the same protocol, and use it at a larger scale so we can have the data, and also combine the AI intelligence with the doctors and the results from the exam so it can develop from there. So that's where we are right now. We already have these partnerships with university and are starting to standardize our procedures so we can have strong data. I mean, that's the key here, right?
Thank you so much. Damien, is that the answer to your question?
Absolutely, yes. Thank you very much.
Really good questions, good follow-ups on the pitches. Is there one more question we could take? If not, then I say thank you very much, Anariá, Digital Oncology Service from Brazil. Really impressive and really good pitch, really clear, good question. Thank you so much, all of the jury, to get even a clearer picture. I think that is really important for the voting procedure. And now we're moving on to our next winner in our category, Health and Wellbeing, and that would be BokDoc. are you here and ready? I can see you. Hello, hello.
Yes.
Good to have you here. So you want to share your slides and your pitch?
Okay. Now you see my screen?
I can see it, but
okay, great.
Okay. This is how it's going. Can we start also with the clock? Hold on. Yes, go.
Okay, good. Thank you. Hello, everyone. And my name is Ahmed Lawadi. I am eye surgeon and healthcare manager certified from the American University here in Cairo. I am based now in Egypt. And BokDoc is the first surgical marketplace here in the Middle East. And this is our vision to make the world's healthcare more accurate and easily accessible for everyone. And let me tell you a real deal story. We almost see it every single day in our hospitals. This is an example of a patient who wants to make a cataract surgery. This patient wants to reach the best surgeon for his case. He will ask his relatives, family, friends, and like that. They may recommend 1, 2, 3 surgeons or like that for him. The main problem we found here is that many of those patients can't reach the best surgeon for their case. They reach the surgeon who their relatives know. And this is a problem we want to solve, the surgical complications. And these are statistics from the American market itself. 50% of the surgical complications are because of the surgeon mistake, the provider error, the bad surgical skills. And this is a problem which we want to improve and enhance. So we made our solution BokDoc. Through it, any patient can search about any surgery from anywhere of the world. He will select multiple surgeons and hospitals. He can send his medical case description for free to multiple of them. Then he can receive multiple medical opinions and compare between the surgeons. And here he can compare the reviews of the previous patients who made the same surgery with the same doctor. And here only on BokDoc, we review the surgical outcome. This is our target. Then to continue the patient journey, we make for him an examination, free examination with 1, 2, 3 surgeons till he decide what is the best for him, and then we schedule the surgical date. We are the first here in the Middle East to make such solution. All of prices here are total and clear, and we give our patients a free examination with the surgeons and even cash back after just he make his review. We are the first also to provide installments for all of surgeries on BokDoc, up to 5 years with 0 interest and no advance payments. We already registered in US as a C corporation and our company here in Egypt, and also we are opening our branch in Saudi Arabia. We have now more than 1,500 different surgeons registered with us in 30 different medical specialties. We already exceeded $3 million as sales amount. Our average growth year over year is more than 500%. Until now, we exceeded surgical transactions more than 3,000. And we already now have international patients from about 10 countries, and all of that without any paid marketing. This is only organic marketing. As a medical tourism, every single month we have 230,000 patients search about their surgeries on our marketplace. And this is our team. And we are helping and supporting the third goal of SDGs. And thank you for listening.
Thank you so much. Thank you. Sorry, showing you the 3 minutes are almost over. It's really a short time. So thank you so much for your pitch. We've seen something very interesting, but completely different from the 2 first pitches that we saw. So please, your questions for BokDoc. What would be the questions? Gabriele, please. Thank you so much for your questions.
Thank you for the presentation and the impressive numbers you have reached already. I would be very interested to learn more about how you review the outcome. This is not clear for me. What is your quality check?
Okay, great.
Very important.
We make only the review after the patient makes the surgery with the surgeon from our service. So these are real patients through us, through BokDoc. This is the first thing. It's like booking.com for hotels. The second thing, we have a criteria for reviews about the surgical outcome, about the quality of the service, about the quality of the doctor, and the likes it. And also there is a good point here about reviews, because it is important for many people that we make the review by surgery, not per surgeon. Which means, for example, I am already a surgeon. For example, maybe I am excellent in LASIK, and at the same time, I am so bad in retinal surgeries. So I will have 5 stars in LASIK, and at the same time, only 1 star in the retinal surgeries.
Thank you. Question answered. Do we hear more questions, please? Tomasz?
Sorry.
Yeah.
Okay, now you can hear me. Congratulations again, Hamed. I've seen similar solutions for appointments, so not surgeries, but appointments. For example, Dr. Alia is arriving here in Portugal, and it's the same kind of feedback. You have an appointment with a doctor, and then you have the feedback regarding that appointment. It's interesting to do the same thing about surgery. I don't know how do you do the quality control of the feedback. So it's only based on the patient's opinions, or if there is some preset form also for the doctor to fill with the surgical outcomes, because sometimes the surgical outcomes are not exactly matching with the patient feedback. Well, it's a good solution, and the difficulty with these solutions is to get the numbers, is to get people using the solution, and you are doing that. So a huge congratulations to you and to your team.
Thank you very much. Thank you.
Thank you, Tomasz. So yeah, it was the question about the quality measures. What would you want to answer?
Yes, great. Is this a great question? Actually, we already make an aggressive filtration for doctors before they join us and register. If there is, just to be in a brief, because the time before we register any doctor with us, we make an aggressive search about him. If there is even only one single bad review about him in all of the internet, we don't register him. And already this happened till now with almost about 4 surgeons. And there is another great point here. Regardless the reviews of the patients, if there is any complication from this doctor, surgical complication, the first time this happened, we give him a warning, pure warning. And second time, we block him from BokDoc. That is the process with us here.
Thank you. So I have a last question. Chica, please, you want to go ahead? Thank you.
I do. It's a quick one. Ahmed, congratulations. One thing I would like to know is, how do you bring doctors to your platform?
Okay. First of all, from 2 years ago, we started to make visits to the doctors to register them with us. Now we are famous now in the Middle East, so every single day we almost have requests from at least 10 of different healthcare providers. And here the providers are different types, maybe just a doctor, alone doctor, or hospital or center or like that. Every day we almost have 10 requests from them. We don't approach now and reach out to any new doctors.
Okay, thank you.
Thank you so much.
Thank you.
So you already have the doctors coming to you, and you don't have to go look for the doctors.
Yes.
Thank you so much for your pitch.
Good.
It was really good and interesting, and we'll proceed from here. Thank you. Please stay tuned. So I want to present to you our next winner of the health and well-being category. A really interesting product. It is from Estonia, Wellbeing Education, and it's the app Clanbeat. So hello, welcome. You are ready to pitch?
I am ready.
Go ahead, share your pitch and share the screen with us.
All right. Do you see my first screen, which is yellow?
Yes.
This is it. All right. Hi.
Is it working?
I'm
okay.
from Estonia.
I'm so sorry, Kati. I always have to check with, are we ready and can we start with our, technicians?
Yes, I just came out for a second. Now am I now? That's weird. I would play. I can close it for. I have one only. Let me try again. Let me see. How about now? All right, I give me 1 second. I will do PDF and.
Yeah. Just take your time. No stress. We have enough time. We're really good in time for all the pitches and all the discussions and everything. So no, it's no problem.
All right.
So
it is here.
It's always the sharing the slides. There's no who is ever gonna make a good solution for that. We have to add this as category to WSA. Good slideshows, easy to use for everybody.
When we were testing, it was working. So
it's always like that. So no, everybody knows the feeling. It just worked. Why is it not working now? But we can. If you don't have the full screen, would it matter so much? I don't think so. So we could just go ahead.
Maybe no.
Yeah, otherwise it's fine in the presentation mode you just had. Completely
yes, fine. I think that is okay too. If it's not working in full screen, then. Do you just want to share it like you did before?
The PDF got ready. I think I'm ready to share the PDF. One second.
Great. Okay, so we are getting ready. I'm just saying it one more time for the Clanbeat Wellbeing Education. And it's about a place where students and teachers can meet, as far as I remember it, about mental health and well-being. Okay. So let's do it just like this, I guess. And I think if you are ready, Kadri, should we go ahead? Or do you need a few more?
Yes, I'm ready.
Okay, then please, let's go.
Sorry for the delay. Hi,
no problem.
I'm Kadri from Clanbeat. and it is really close to our hearts to think about students' well-being and how it is catered and how each student is noticed in the schools. And actually, well-being is a really focused thing in our personal lives and in the workplaces, but actually not so much in education. But why is it so? Here is Tiffany. She's actually my own daughter. She's 15 years old. Outside, she looks like a model kid to me and maybe even to somebody else. But she's a straight-A student, has so many awesome hobbies, playing saxophone and etc. But underneath, she's overwhelmed, she's stuck, she's struggling with time management and not getting enough of sleep and sometimes having overeating purse and etc. And this is actually the big problem of youth, because the society is putting so much pressure on them. And over 62% of girls have experienced burnout and 41% of boys. And if you think about, like, there's one school psychologist, at least in Estonia, who has to serve 800 students, how this problem is going to be solved. And this is not only a problem of students, this is only for the teachers and us grown-ups as well. And it is our mission to actually deal with that there would be less stress and burnout for students, and that the people would be able to fulfill their potential in the world. And how we are actually doing it is that we are supporting students in taking active role in their life and learning. And we are taking them on a journey of planning out their actions, that their days wouldn't be burning them out. They are going to be acting out among their peers, and really big part of it is on reflection. So we have digital e-diary where they are reflecting their actions and really understanding how those things in their days are affecting them and how they can design days which are not so stressful for them. And through that, we are really focusing on helping them to adapt the key skill of really being adaptable towards the world and being agent about their own goals. we are having built into the product well-being support. We have daily and weekly check-in questions. How are you feeling? How are you sleeping? Did you have really good relationships with peers around you? And we are reflecting the data back based on the reflections diary and based on the inputs on the surveys, and reflecting the data back to the students themselves, and also to the group lead who is homeroom teacher or school counselor, and really making those students who are invisible visible and giving them the potential to really help themselves. But if they are not able to help themselves, to give them the right direction to go and get the help. And it is really important for us to focus on students having the self-knowledge of self-help and early prevention themselves. So because there is not enough people to deal with students' mental well-being. And we also help them to build positive habits based on our productivity planning. We also give knowledge base to students.
Last sentence, Kadri.
Thank you.
Thank you so much.
Thank you. Thank you.
Thank you. Thank you, Kadri. Thank you for the Clanbeat app for wellbeing education. I know so much to say and so important. Absolutely. So guys, do you have questions? How is it? How does it work? Etc. I can already see Gabriele. Please, you go first.
Okay, thank you for this presentation. It's really a very urgent topic, and it's good to see a solution for that. What I would be interested in is really the data protection issue and how your business model likes, because this is a very sensitive issue, and I can imagine that maybe your client group is not the financially best fitted group. So this would be very interesting for me to hear how you plan to deal with that.
Thank you. Very important questions. Sorry, Kadri. Yeah, go now. Sorry. Please.
Yeah. For data protection, we are GDPR compliant, and we are really focusing on giving the power to students themselves. Our focus group is students 11 years and up, and they have the power to choose with whom they are actually choosing to share the data, either only with themselves. Even then, we are able to help themselves and reflect the data based on our AI back to them and prevent some things happening. And if they are willing to share the data with a counselor or with the school, then we are able to give them personalized help and interventions from the school side as well. But the students are the center point of everything and deciding on how to choose the data. And in a younger student's case, the parents are going to be helping them to make those decisions. And the second question was related to, maybe you can remind me.
The business model? How do you?
About the business model. Yes, we do have free tier in our product, which helps students to monitor themselves and get the reflections and directions back to themselves in a free model. But if the school or the state wants to have centralized data and insights based on the data on a class level, on a school level, and right now we are working together with Estonian government to work through the national students' mental well-being data together with National Health Institute. So then these are paid tiers. But for individual classroom, every individual classroom can use us for free.
Mm-hmm. So what you really do need is you need the people, you need the teachers, you need the counselors that use the tool that is Clanbeat. It is supposed to support the structures and the personnel that you need anyway, though. So it's a supporting tool.
It is supporting tool for those schools who are actually having the really good support system already set up. But for those schools, for example, 2 hours ago, I landed from Jordan, and they have one counselor per 3,000 students, meaning that they actually don't have enough personnel. So for them, actually, the self-help materials and reflecting the data back to students themselves, giving them the agency to help themselves is already a really big thing. And we also have social communities inside our product. So the students could create peer groups among themselves to take away the pressure from getting more people to be counselors. Yes.
Tomasz, please.
I think you can.
Go.
I would like to congratulate you, Kadri, for the app. I have two questions. We didn't see your metrics, your impact metrics, and I would like to know them. And I also don't know what is the regulation about this, because it's borderline a medical device. I don't know what is your understanding about the medical device legislation. If it's focused on well-being, I think you can manage to escape that. But if you involve or enroll the psychiatry line, it's going to be a medical device, and it's sometimes a nightmare for you. But I love this kind of solutions. This is the same thing about cardiac monitoring, because in cardiac monitoring, you can also measure the mood for the patients and then apply an intervention in that mood. The difference here is that when you talk about cardiac patients, the insurance companies are going to be the ones buying the products, and here you must work with the schools. So if you are able to do that, if you are able to sell your product to the Ministry of Education of Estonia and then of Jordan and then of other countries, you will have a solid business model. If you are talking about B2C model when you sell directly to students, I think it's going to be more difficult, but I definitely support the B2B model with schools. And again, congratulations for your results.
Yeah, good question. Although you already started the panel discussion, Thomas. That was long. Yeah, I think it's really tricky too. You know, how can it work in borderline medical device? That's true. It would be pretty tricky here too. Chica, you have one more question, please.
No, it was a question.
Sorry. What was the question?
Yeah, I got the questions. Thank you. Actually, there were many good questions.
Sorry.
We launched in Estonia in the beginning of last year. We reached 40% of Estonian schools in 4 months. We have users worldwide. The impact insights which are coming into our program is that 32% of all the students are having trouble with sleeping. 27% of them are indicating that they are waking up in the morning and thinking there is no point to this day. And we are able to visualize this data to students themselves and direct them to help and visualize it to school and local municipalities as well. So these are the impact insights which we are able to visualize. Right now, we are working with, in Estonia, there is this program called Accelerate Estonia, which is like they're having this slogan, if we gave you a country, what would you do with it? And we were accepted to this program to work on mental health data, how this will be legalized, how the data is flowing. We are working together with National Health Institute to really make it digestible and accessible to all of those sites, that it would be ethical. We already passed the ethical council, and now we are on to doing the impact service within this school year. And this is something we are looking forward, because this can be a really good role model for all of the other countries as well, because this is really sensitive topic. This is personalized health data, and how to personalized way direct the impact answers back to you and direct, even prevent some things happening. This is something which is really dear to our heart, that we could prevent all of these statistics right now, which are coming into our platform, which we are able to see and analyze, which is not okay. These statistics are not okay, and we are really working on making them better.
Yeah, very tricky, but very important. Chica, you have another question? Am I even saying your name really right and nicely?
You are super, Tanja. Danke. Kadri, as a mother of an 11-year-old girl, I can totally feel all your motivations and everything. I think Clanbeat is beautiful. And I would like to ask you, what is the thing that you have achieved so far that made you the proudest? That you look at it and you are like, wow, look at what we're doing here.
3 things. One of the things is that my own daughter has gotten into much more better state with being a co-creation partner together with all the other schools. The second part is this Accelerate Estonia program, where we are able to think through in country level, how to make one country better, which can be replicatable for the other countries. And today, 2 hours ago, I landed from Jordan, from UNRWA, United Nations Relief Program for Palestinian refugees, and I have really big empathy towards those children in the world who are not able to get help on those topics, and I really believe that we have created something which could ease the pain of not having personnel on right places. Although in refugee cases, we actually need to have the device problem solved as well. But as soon as this is solved, we are able to help them. And I'm really proud of that, in a way that this is actually helping people, and we have the feedback and the statistics to prove it.
That's great.
Thank you.
Congratulations.
So much. Yeah, congratulations too, Kadri. Really impressive. Thank you so much for your pitch. Wonderful.
Thank you. Thank you.
So, guys, we move on to the last winner in our category, health and well-being. And this is from Iceland, RetinaRisk, which is a really impressive product too. And I ask you, are you set?
I'm set, Mercy.
Yeah, let's see if you can share your slides, your pitch with us.
Let's see, gonna see how that. All right, now I believe that I'm sharing.
Yes, we can see something coming. Yeah, yes.
Are we okay?
We are okay, and I think we are also ready to go, are we?
Absolutely.
So then.
Thank you very much. My name is Silla Jónsdóttir, and I'm the CEO of RetinaRisk, a health tech company founded by an Icelandic team of doctors and scientists to transform the future of healthcare with personalized approach based on individualized risk assessment. Our vision is to develop risk calculators for all diabetes complications and other chronic diseases. Our initial focus is on diabetic eye disease, which is one of the leading causes of blindness in the world today, which can be prevented in over 90% of cases with early detection and timely treatment. We have developed a unique, clinically validated software solution that accurately calculates the risk of sight-threatening diabetic eye disease. You simply insert 6 risk factors, and in a split of a second, you receive the individualized risk calculation, the key risk factors for each patient, and when that patient should come back for eye screening appointment. With RetinaRisk, we empower the patient to better understand their condition and to take the necessary steps to prevent vision loss. We serve healthcare providers as a decision support tool to stratify the entire cohort and to identify high-risk patients who need more intense care. We also enable healthcare systems to streamline diabetic eye screening programs to make them more efficient and cost-effective. We support the UN Sustainable Development Goals in several ways, particularly number 3, by increasing access to universal health coverage, but also by reducing inequalities and even reducing the carbon footprint with fewer unnecessary doctor's visits. The potential impact of RetinaRisk is huge. We can double the eye screening capacity around the world to reach more patients. We can reduce healthcare costs by 30 to 60%, resulting in billions of dollars being saved around the world. And most importantly, we can help to prevent vision loss among the global diabetic population of 537 million people. Thank you very much for your attention.
Thank you so much. You have 20 seconds to go.
Really? So I could actually answer. Yeah, I guess I get more time for the questions.
we will use it. It was fantastic. It was clear. It was to the point. And I can already imagine that there are some questions being asked. I don't see the hands raised yet, but
too fast and too clear.
What are your questions? Tika, please, you go first.
I'll make the first one then. So I would like to know, what was the best feedback you have ever had so far from RetinaRisk?
Well, obviously, having a product that can actually save the eyesight of millions of people, having the direct stories of individuals in several countries around the world is what really gets us out of bed, very excited every single day. So having the possibility to empower people that they can actually see the connection between lifestyle changes and the risk of serious complications like eyesight is very powerful.
Great, thank you.
Thank you so much. Gabriele, please, your question.
Thank you for your presentation. I always wonder how you motivate people who are not aware of the risk to use your tool. So how are you really communicating it? And also, who are your clients now? Is this the individual person or are they doctors and hospitals?
Thank you. Please, go ahead.
So basically, we actually serve the entire spectrum. With the app, we are actually reaching out to the patient, and there we are very much focusing on raising awareness. This is one of the problems today, that too many people don't even know that they have diabetes, and then they don't know of these serious complications. So the app is really meant to inform the patient and make them understand the linkage between lifestyle changes and that you can actually reduce the risk of sight-threatening diabetic eye disease and other complications as well. We obviously deal a lot with doctors who are actually using our tool to support the decision-making, to actually find the high-risk patients and to make things much more cost-effective. So with our B2B solutions, we can actually serve the doctors and the medical community, and with the app, we do actually reach the patients themselves.
Mm-hmm. Tomasz?
Okay. First of all, congratulations again for the solution. I have two questions. First of all, you must be certified as a medical device, so it's just a confirmation. And then a second thing, do you integrate or plan to integrate the results of the eye exam that occur in those clinics? Because, well, you basically calculate the risk with some simple medical measurements, such as hypertension, glucose, and the duration of diabetes. But a game changer would be to have an auto eye exam, or to incorporate the results of the eye exam that was occurring in the clinics. So are you planning to use that kind of artificial intelligence in the solution, or will remain to be just a calculator? Thank you.
Thank you.
Absolutely, thank you for this. First, on the clinical validation, very extensive clinical validation and already CE marking, and working on the FDA approval, and also for the UK, that they have now a separate one. We actually need to have the results of the eye exam. That is one of the risk factors. And what we do actually match very nicely with the AI grading of the images, which there are numerous companies that are actually providing that. That fits very well into our solution. Our vision is really that you will have this all even in your mobile app, that in the future, and this is not a very distant future, that you can actually take even a selfie of your retina. You can have the AI grading to actually grade the images, and you have RetinaRisk to actually tell you what is your risk and when you should actually next take that image. So absolutely, this needs to be color combined.
Thank you so much. Actually, I don't see any more questions. So I would just say thank you, RetinaRisk from Iceland. Thank you so much for your pitch. Thank you all for your really, really fantastic products and pitches. Very interesting.